Hello, everyone. Thank you for joining us today. My name is Farhana Arastu. I'm the Programs and Policy Director here at MCMS. We're so grateful for all of you to join and show interest in this process. This is leading up to one of our most important times of the year where we do the House of Delegates. And it's basically where we begin talking, where the formal process of creating the legislative agenda begins. So let me share my screen and get it started. But before I begin, I just wanted to note that Dr. Shannon Pryor and we did have Dr. Carolyn O'Connor on, but there are past presidents and they've been very active in the past at the House of Delegates and in this legislating process. So feel free to shout out anytime you'd like to contribute. If you want to speak now and introduce yourselves, please.
I'm Shannon Pryor. I'm a past president of MCMS, MedChi, and I was a delegate in the AMA House of Delegates for many decades. You won't see me around quite as much anymore, but as a longtime past chair of the Montgomery County delegation to the MedChi House, I can definitely speak to any questions you might have or an overview of the process. I can also help draft resolutions and edit resolutions as needed before presentation.
Great, thank you so much.
And I'm Carolyn O'Connor. I'm here. I'm a past president. My phone is listed as Joe's iPhone. I'm having computer problems, but it is my phone. And I don't have nearly the experience that Dr. Pryor does. However, I have a passion for advocacy and for the House of Delegates because that's where we make policy for MedChi, and that's where, the room where it happens to some extent, except when we're visiting Annapolis or the Capitol Hill. So that's my 2 cents.
All right, thank you. So let's get started. So what is the House of Delegates? House of Delegates is where we have all the different Maryland, MedChi and Maryland components come together. They send their delegates, and this is where we develop and adopt policy. And this policy is how we determine what the legislative agenda will be for the upcoming legislative year. So these are we address a lot of the issues affecting patients, physicians, and we really want to think about what the issues are so that we can create these policies and create advocacy priorities. And we participate in the governance of MedChi. So this is where a lot of like the trustee election, or a lot of the nominated positions get, the positions get nominated for some of the larger committees. MCMS has 26 delegates and 26 alternate delegate positions. And so I'll get to that on what the process is for becoming one. HOD meets twice a year. We have a spring House of Delegates, usually in April. It's usually virtual and a Sunday morning. And the focus of these meetings are for MedChi governance, general policies, issues on an organizational level, changing any of the bylaws. And sometimes at the beginning of the meeting, they'll have CME opportunities. And so it's like an hour lecture and a CME lecture opportunity. In the fall, which is lately in October, it's an in-person meeting. And it's Saturday at a hotel near BWI. This year, it's here at the hotel at Arundel Preserve. It'll start at 7 a.m., run till around 3 p.m., Saturday, October 10th. And also at this meeting, they will have some kind of lecture. Sometimes it's a CME, sometimes it's not. But this part of this specific HOD is where we focus on the legislation, regulation, and policy. And so this is the website. If you want to register to attend, I can send that link out in an email later too. So who can be a delegate? So to attend the House of Delegates meeting, any member of MedChi, any member of MCMS can attend it, but you have to register. But in order to serve as a delegate, you have to be a current dues paid member for this current fiscal year. And there is a formal process where you have to let me know, and then you get added to the delegate or alternate delegate roster. And these rosters have to be submitted to MedChi 30 days before the HOD. So for the fall HOD, the deadline is September 10th. So you can attend any of these. You can attend these meetings, but to be on the official roster, you have to, and to represent and to vote, you have to be a delegate on the roster. So leading up to the HOD, there's working back all the way back. We have to really think about what are the issues and how do we turn them into resolutions. So if you remember earlier on this summer, maybe in May, we had a listening session. This was us to start that conversation about like, where are the issues? What can we address? And so we ask individual physicians, we have these sessions, ideas come from many board members. Us as staff also recommend certain recommendations if we see something continuously happening and we're hearing physician complaints about an issue. And, we just want to make sure we're a good sounding board for all of you members to sound your issues, and so that we can take them and then eventually turn them into a resolution that can then become some kind of policy. So we really want you to think about what are the problems physicians or patients are facing, and what should we do as organized medicine, and what should we do about it. And so I try to keep a running list of it throughout the year. And then we put it together and discuss it with board members and figure out with our executive leadership which ones are the priority issues that we should then turn formally into resolutions and submit to MedChi. So what a typical resolution includes are whereas statements and then resolved statements. The whereas is where we state the problem. We try to give good evidence and facts and what policies already exist, so that we can really give a clear why we need a resolution for this and what is the issue. And then we have the resolved statements, which are what actions MedChi should take. And we review these resolutions and we submit them to MedChi for approval. And again, similar to the delegates deadline, resolution deadlines are also 30 days prior to the HOD meeting. So before a resolution goes to MedChi, we discuss these ideas internally with staff, with executive board, and we develop these ideas. We draft a resolution. So MedChi's lobbyists have requested us to submit resolutions prior to the September deadline so that they can review it as well to see if there's existing laws and policies and see if there's any additional information that would be helpful to us to make it a strong resolution. And also if something already exists, then we don't want to duplicate efforts. Then we review it with MCMS leadership, and we require board and executive committee approval in order to submit it to MedChi. So these resolutions and ideas, because of the timeline, we try to get this all done in conjunction with when our board meets, so that we have substantial information that we can get approval and their discussion and have proper discussion about these issues, and develop a resolution based on consensus. So we try to start early. It doesn't always work out because summer is difficult, but we tried our best, and we submitted 2 resolution ideas and 3 concepts to the lobbyists last week for their review, and we'll be working to develop it and fine tune it to have it ready to be submitted by September 10th. So there's a few other meetings that happen. There's other few processes that happen before HOD as well. So but prior to the HOD meeting, after all the resolutions are submitted in September, we have one more large meeting that's usually done virtually. It's called the reference committee meeting. And this is really where we have the discussion of all the resolutions that have been submitted by everybody. And so all the resolutions get reviewed. We hear testimony from the physicians that submitted it, and hear in detail why they want certain things done. And then we discuss the concerns and proposed changes here. And then we make recommendations to the HOD here. So this is where a lot of amendments can be added. This is where a lot of the discussion happens. And this is a really important part of the process. So even if you're not able to go to HOD or you're not a delegate, but you are interested in a particular issue, this is a great place to have that discussion and to listen in on how those resolutions really, really come together. So then once that's done and the reference committee has met, then there's four things that can happen to each resolution. It can be adopted, it can be adopted with amendments, it cannot be adopted, or it could be referred. And so it could be referred to another committee. And then we have one more meeting after that that is just MCMS. And it's our MCMS caucus. We try to do it at least a week before the HOD, but it really depends on the reference committee and when they send out their reference committee report. So at this one is where we review the reference committee recommendations. We discuss the important ones. We discuss the ones we've submitted and where we stand on it, if we agree or disagree with the reference committee decisions. We hear the concerns from our delegates, and we decide what action needs to be taken. And if action does need to be taken, then we'll prepare for testimony or amendments or extractions. So if we have to do testimony and amendments, the process is to extract it. So if MCMS disagrees with the reference committee recommendation, a resolution can be extracted for consideration by the full HOD. So at the actual HOD meeting, we hear all the delegate reports and recommendations. The resolutions are considered, and then delegates can speak for or against the resolutions. So remember when I had said about the extraction? So usually they have the full resolutions get passed at once, except for the ones that get extracted. And the ones that get extracted then are up for further debate. So then this is where we have the opportunity to speak, and you are able to speak on behalf of yourself, or you are there to speak on behalf of the committee. I mean, on behalf of MCMS, if that's what we decide, that's the action we want to take. And so we can propose amendments here. Sometimes we're able to propose amendments and have them written ahead of time and submit it, and still extract it and have approval for it so that they have the wording that we want. And extractions can then be voted on, and then the delegates vote on each extracted resolution. So in general, your role here isn't just to attend these meetings, it's really to help determine the policy that we want MedChi to develop and have for our upcoming legislative session. So now I turn it over to our past presidents to add any additional information that I may have not covered, and also why, from their perspective, it's a good thing to serve as an HOD delegate.
So I have a quick question. How many total delegates are there? So Montgomery County, we have 26 out of how many?
Ooh, I don't remember that number at all.
I don't know either, but we are by far the dominant component. Montgomery County has far more delegates and members, and that's why we get more delegates. But we have
So
far
how
more
is it you
members
get
than the next most populous county.
those are the formula based on your membership? You get X number of delegates per your membership.
I
Okay.
want to say, I think it's around 100 delegates total.
And then
So we're
there's
like a quarter of them.
there's
Yeah.
a quorum, which is probably around 60 or something like that, or 55. So the first thing is to establish there's a quorum,
Yeah.
which the secretary does.
Yeah, we had an issue last year with the quorum where we had a quorum at the beginning of the meeting, And we did not have a quorum by the end of the meeting when we actually needed to have proper votes happening. So it's important to stay till the end, even if our things have passed, because then if there's any amendments and things that need to be voted on later, and we have people leaving, then
Never,
nothing gets voted.
yeah, never be that guy who calls the quorum in the middle of the process. Unless things are about to go some way that we really don't want to see it happen, do not take that nuclear option. It happened once, and people were angry at that person for like 5 years.
Dr. Dugarala, do you have a question?
Yeah, so when you say 60, you said there's alternate delegates. So when we talk about 100 delegates altogether, if someone is missing or someone leaves, does the alternate delegate automatically take that place? How does that work with the alternate delegates?
You can re-credential during the meeting if you have to, but typically we don't. We don't tend to have our full complement of delegates, much less the alternates. So our attendance, basically both the delegates and alternates who attend are generally credentialed as delegates
I see.
at the time of the meeting because we just don't get that many people to give up their weekends.
Yeah, we never, since I've been here, we haven't exceeded like 22 maybe.
We'd love to.
So usually we have just enough to make our
Okay.
group. Is there anything else you guys are curious about? Are there any issues since this, are there any issues that you guys have seen in your patient community, issues you're facing as a physician that you want addressed at this?
I can add a few things based on your slides and kind of elaborate a tiny bit. In terms of the issues that you're facing in practice and bringing them forward, a lot of them we're fully aware of. I mean, for those of us who do procedures or did procedures, the down coding the modifier 25 and the E&M code associated with it, it's just outrageous. Of course, our academies are going crazy about this. AMA is going crazy about this. We're on it. There's probably nothing additionally that we as MCMS bringing it forward to MedChi are going to be able to do about these kind of nationwide issues, or, we all know that prior auth is killing us. We all know that tort reform is absolutely critical in maintaining that cap and things like that. So we don't necessarily, sometimes those are the biggest things affecting your practice. We don't necessarily have new solutions to those. And if you don't have a new solution, bringing it forward is not going to be helpful. What we do when we come up with a new idea or identify a new problem is say, is this something where we have a different idea as to a policy or solution that could be implemented that is unique and not already being implemented at the state or national level. So you may have the best idea in the world, but if that's already policy at either MedChi or AMA, it's really not going to make any sense to bring that forward. So especially what we want to be on the lookout for are these hyper-local things that may actually be going on somewhere else. So if I find out that you have a problem, but that's also happening in every other county in Maryland, well, we need to be talking about that. If I find out that you have a practice related problem, but they're also experiencing it in Ohio and California, well, that probably needs to go to AMA. And you don't have to have the solution to the problem when you come forward, but if you do have a unique solution or idea as to a way in which we might approach something, absolutely bake it into your idea when you bring it forward. We can help write everything for you. But when you write it, the whereas clauses don't go into the policy. The whereas is just, this is why I want you to vote for this. This is why I think this is a great idea. The resolved clauses are the language that gets encoded into the policy. For this reason, the resolved clauses do not refer to the whereas clauses. They are two separate things, and only the resolved clauses become policy. So those clauses must stand alone. and they should never be referring to something that might change. So if you say we're going to support everything that, the AAP, American Academy of Pediatricians, or pediatrics does, that's not a good plan because the AAP might change their policy. You have no idea what might happen next year or the following year. So you need to actually write out everything specific to which you're referring that needs to be included in the resolve clause when you do that. But we can do that. The
Yeah.
other thing is that even though MCMS tends to caucus only after the reference committee report, it is very helpful for you to be aware of what's coming out in the book. Take a look at the book, read the book, and maybe even consider communicating with the other delegates or with MCMS before the reference committee meets. Because if we're not represented and we're not speaking at the reference committee, then we kind of lose the right to really weigh in that much at the HOD. The idea is that if you have something to say about a resolution, you should be presenting it at the reference committee. And if you can't do it personally, somebody else will be able to represent MCMS at the reference committee on your behalf. It's a virtual meeting, takes place before the actual HOD, but that's where the nitty gritty comes out. And that's where if you have a personal story or experience, because personal stories are really what sway ideas and influence voters. If you have a personal story or a personal experience with this issue, you really need to try to be at the reference committee and present a unified front there. Yes, we do caucus again before the HOD to see how things went, but very often it's at the reference committee where you have the biggest chance to make a difference. Those are the little notes that I put aside.
Thank you, Dr. Pryor. Dr. DeGarella?
Are there any resolutions that we're currently working on?
Um, yeah, we have ideas for a few, and we submitted 5 concepts to our lobbyists for review. I can send that out later, but let me find it and then I can give you the general gist of them in a minute.
Sure.
I'll actually be going out to meet with the lobbyists tomorrow to kind of discuss everything. So there's a prescription authorization legislation. There is another on possibly trying to bring gold carding to Maryland. There's what are some of the other ones for Hannah?
Peer review transparency.
Yeah.
So we are looking at peer review transparency enforcement. We have one for asynchronous care. So payment for clinically significant asynchronous patient care. We have one on protecting Medicaid coverage during the implementation of work requirements, because that change is coming up in January and that's going to hit a lot of people. We're still working out the language for that. And then we have a proposed concept for Medicaid coverage across the DC Maryland border.
And some of these might wind up being nothing. And, the lobbyists might tell us, I'm sorry, excuse me, there's no reason for us to do this. But when members bring us concerns and bring us their issues, we do make sure that we always follow through all the way to the end of that request. So if the end of it is at the lobbyist or if it's going to the HOD, we do try to make sure that whatever concerns you're bringing to us, we do bring as far as we can.
Yeah. Dr. O'Connor, would you like to add anything?
No, not particularly. I think Shannon's done an excellent job, and so have you and James, of explaining what's going on. And I do agree that the reference committee is vital, and it's also just very informative because you hear what people are thinking about these resolutions. And then when you're at the HOD, if they're extracted by us or by anyone else, you already have sort of a background in your mind of what the issue is. And so even if you're not on the reference committee, absolutely everyone can attend the meeting. Only the members of the reference committee actually vote whether they're going to recommend to adopt, to extract, to not adopt, to adopt with amendment. All that that's going to be in their report, but you get to speak on what you think of the resolutions, all the resolutions, not just ours. So I agree with Shannon about trying to attend even part of it if you
Yeah,
can't
it's
be
a
there.
very intense meeting, but it is like really where the debate happens on every resolution, and you hear some very interesting perspectives, things you would never have thought about otherwise. And it's a fascinating conversation most of the time. So I highly recommend it if you are interested in this process at all, to at least attend the reference committee meeting.
Can I say a little bit about what else goes on at the HOD meeting? In addition to kind of informative and awards, informative presentations, awards, and usually some CME and a few exhibitors, there are also politics within MedChi. Believe it or not, this does occur. You will have elections. Often they are not contested, but sometimes they are. If we have a candidate, we usually encourage you to support our candidate. But if not, MCMS has at least one member of the board, of the MedChi board, because we have a designated member on the MedChi board. Sometimes we have others. So occasionally we'll have 2 or 3 members on the MedChi board. If you're not so sure whom to vote for in a contested election, it is always useful to ask the current members of the MedChi board with whom you have a familiarity, or even if you haven't met them, introduce yourself to the Montgomery County Medical Society representative to the MedChi board and say, hey, I'm one of the delegates. What do you think about these candidates? Because a lot of times the speeches or the published information is not going to give you the full story, and you always want to act in the best interest of the society. Carolyn knows what I mean. Um, but really, I encourage you to show up and to participate. Um, it really is a useful experience, and one person really can make a difference here. You can have your idea go all the way up to AMA and see AMA get it enacted for you. It does happen, it can happen. And one good idea is sometimes all it takes to change a very onerous problem. And this is MedChi is very well regarded at AMA. We're somewhat powerful as far as small delegations go, and we can get a lot done. And getting things done in Annapolis, again, it's so wonderful that we are so active with advocacy and that our legislators will turn to us when they pass laws. And this is one of the ways in which we do it. They know that we have a process where we engage with physicians across the state with all different specialties and all different modes of practice. So they know we have an inclusive and democratic process for setting our policy, and that when we come before them in Annapolis, we know what we're talking about, and we usually bring people with us who have stories and can talk about instances of when it happened. Well, this is how all of that is planned, put together, and brought forward. So it's really useful to participate. Don't be intimidated. We will take your hand and guide you through the entire process. Actually, I won't, because it always overlaps with parents' weekends at the colleges these days, but I will help you write your resolution, and I'll help you get it past the reference committee anytime. I see a hand.
Yes, hi.
Yeah.
Sorry, I had another meeting, so I couldn't join as early as I like to. I can see Dr. Irfan. I know him very well, my husband's friend. So I am actually the president of the local chapter of PulpMed. It's Post-Acute Long-Term Care Society. So at this time, I have Maryland, DC, Delaware. And as a geriatrician, we actually took a bill last year to the House of Delegates of the certification process for the certified medical director that PulpMed has. It actually got passed at all levels, and it was my first experience taking a bill to House of Delegates. And we connected with Lifespan and ACA, as well as Leading Age, and they all promoted it. But it actually got stopped at the last stop of the Senate. So it was quite an experience of taking it to the House of Delegates, then the finance, and then the Senate finance level. But then a lot of other things happen all around the world too. So we do want to take it next year also. But I do understand what you're saying. It's quite an experience, and it is intimidating. But that's where we can take our voices, and that's where we can make a difference at a big level. And I do know every year almost 800 bills are passed, and it has a season. But from our medical society, it's only just few in numbers that are taken to the House of Delegates.
I think you may be talking about going to the legislature with something. Now, the House of Delegates is an internal body within MedChi, and your other organization may have its own House of Delegates, but the lower house, the delegates in Maryland is in Annapolis. But here we're talking about our own internal body for MedChi for setting policy.
Yeah.
I see. Okay,
but
I
there's
see.
a connection. So
but there is that connection. So when we develop the policies internally, then we decide what will then go forward into the state legislature, which is the experience you were speaking of.
I see. And you guys take all over the medicine, like all the way from pediatric to the end?
Yep, all
That's
specialties.
very interesting.
If you're a physician, then we will take up and carry your banner forward.
Yeah,
And
sure.
if it's something that, every now and then MedChi says, you know what, we support this idea, but we're not going to make it the forefront of our advocacy efforts for the year. A lot of times, when it has to do with audiology scope of practice, they bring us in, the ENT Academy, like I show up and I testify, and then MedChi will back us up because we have that policy. It might not be, the top 5 things on their agenda, but because we have policy supporting that scope of practice issue or supporting the physicians on that scope of practice issue, we know that MedChi will at minimum write a letter supporting our testimony. So sometimes the specialty society has to weigh in too, or even has to be the primary carrier there. But MedChi will weigh in, and that does make a difference.
Yes, thank you. Yeah, it does. I think the voices have to work together, and then only it can make a difference. So I really appreciate it. I'm just on the other end, like the last end, but I do feel, the ratio between a geriatric provider and patients are going to get worse, and it's 1:700. It's going to get worse. It's going to be 1:1,500. I don't anticipate that I will continue to work that way. So we really need to make a difference. Thank you so much for everything that you all are doing.
Thank you so much for sharing, Dr. Naqvi. Is there anybody else that would like to bring an issue forward or share why they joined us and what they're interested in?
I can just add maybe another comment or two. Generally, when we caucus, we look at the reference committee report, we decide what we want to extract, and our caucus will vote to support or not support or oppose the various resolutions. And Shannon's been really good about creating a spreadsheet. And if we are going to extract and we are going to speak on resolutions, we usually have someone picked out in advance to speak for us. So that person would go up to the microphone and say, I'm speaking in opposition or in favor of I'm speaking on behalf of MCMS, or if you have a personal perspective that's just yours, you can say I'm speaking on behalf of myself. But they always want to know what position you're taking for, against, and also who you're speaking for. And you have a 2-minute time limit, and there's a timer and a light and all that kind of stuff. But it's quite an interesting process. Sometimes it lasts a long time, and same with the reference committee meeting can go on a long time if there are a lot of resolutions. But it is very important that we speak as one voice if we can. And so if you don't approve of something, you need to say so, or you can approve of something. Go ahead, Amar.
I was just going to mention that I'm coming from the perspective as a family physician. So I'm in Poolsville, and I'm currently the board chair for the Maryland Academy of Family Physicians and immediate past president. So I've been doing legislative, advocacy from the family physician side for a number of years. So I'm still involved with the Maryland Academy of Family Physicians, but I'm really excited to be more involved with MCMS and MedChi. So this is my first time getting interested in the House of Delegates. I think I came as an observer once or twice from the family medicine standpoint, but anyway, just wanted to let you know that I'm excited to start in this process and see how the House of Delegates works, and happy to be to volunteer in any of those capacities.
Great.
Certainly
Thank you so
glad to
much.
have you here.
If I can share that I've been working with Geriatric Society, though a lot of respect for Amar. I'm originally a family physician too, but I went it on the other end. And we do have a robust House of Delegate nationally. And it, as exactly what you're saying, the rules that you are sharing with us are the ones we follow. And it does allow us to kind of horn on things which are more important. But again, I feel at a bigger level and a bigger perspective where you are embracing all the fields, it's really remarkable. So again, for me also, I would love to support and help and learn as we grow.
Who is the current chair of the MedChi delegation?
Are you talking about Jean?
No. I'm asking, I guess, for Hannah or James, who is currently the chair of the MCMS delegation to MedChi?
I'm not sure.
I was for a really long time. And then at some point, I was told that I was not, and I don't know if anybody else was
Now,
appointed
you don't mean
in that place.
you don't mean our Montgomery County trustee on the board of trustees. You mean something?
No,
Yeah,
I
that's
was the
Dr.
chair of the
Berger.
delegation, meaning I put together the spreadsheet and kind of made sure that everybody was up to speed and everybody had been kind of caucused on what do you think about this resolution and all that kind of stuff. The only thing I could never do in that position was I never got to look at the resolutions before they went to the executive board, and that caused problems sometimes, but I would always comment on them right away. So I kind of coordinated our efforts as far as the MCMS, both the resolutions that we brought forward and our responses to the entire delegation book.
Isn't that that's kind of what our legislative committee is doing now
Okay.
with Farhana?
Okay.
Yeah. So we have Dr. Seidelman and Dr. Faulkner. So I've put them in the loop for the resolutions we're sending forward.
Okay. It's a little different than resolutions though, because than legislative though, because it's
It
not
is.
always about legislation at all. But as long as they have that and they're kind of coordinating and onboarding the delegates, that's fine.
Yeah.
Yeah.
Shannon, I
Okay.
think if you're asking about who was the representative for our society, I think the last immediate past president, Aruna was a representative in last delegate meeting. She's most of the time she's presenting our society.
It's not that. It's that there used to be a board position, which was the
Dr.
delegation
Berger.
chair,
Dr.
and that
Berger is
person kind of
Dr.
coordinated
Berger is
everything.
yeah, Dr. Berger is a part of the board for MedChi.
He's he's on the board of trustees for
Board
Medco.
of Trustees.
No, that's not. There was a specific position, believe
I
me,
don't know
but
if we have
nobody's
that
describing
anymore.
it. So maybe it was just eliminated. I don't know why.
I don't remember having it these last few years internally here at MCMS.
No, it was a couple of years ago that I stopped doing it. So I don't know. I thought somebody else was taking over, but maybe not.
I would ask this question from Farhana. What is it that we can do to support you?
Come to these meetings, submit your resolution ideas, continue to be engaged with us during this process. Any kind of communication you have with us is your engagement with us and keeps us in the know of what's going on and what are the issues you're facing.
Sure, and I think I can work and support Amar also, knowing as a family physician, we have a lot of older adults who are staying at home, and we try our level best to have them stay at home before, they can no longer live in their homes, and that's where the other locations come into being. So I do feel providing maximum support to older adults in their home is from the family physician end, which is one end of mine. So again, I feel that's something, and Maryland has the most older adult population out of all the counties and states in the United States. So I think that's something I feel, and maybe I'm more biased, but that's something that I feel is really the need to support older adults because,
Well,
unfortunately,
if you
yes.
see a lack or have a great idea, turn it into a resolution. This meeting is
Okay.
more. This meeting. You're not persuading us that there isn't a problem of too many
Sure.
older people, and I'm over 65 myself, and a family physician myself, so I get that. But
I see.
Tonight's meeting really was just an orientation to the House of Delegates. But if you have a great idea,
Sure.
turn it into a resolution. I'm sure Farhana will, and James and Shannon's brilliant wordsmithing, we can make it into a resolution. So bring it on. That'd be great. We'd love it.
Sure.
Only have short time to do it though for this year.
When is the deadline?
Final submission for resolutions is September 10th, but we need to have it prior to that so that we can have approval from the board.
Okay, sure. And what is the email? Send it to you?
You can send it to me at farastu@montgomerymedicine.org. I'll put it in the chat.
Okay, sure. I'd love to do that.
Sounds good, everybody.
If there's nothing else, I think we can call this meeting to an end. I appreciate all of you joining and showing interest. And again, you have my email. Please message me if you have any ideas or questions.
Thanks, Farhana.
Thank you all so much.
Good night.
Great job,
Thank
Farhana.
you. Good night. Farhana, you have a minute.